Good afternoon, residents, team members, and families. It is December 7th. Thank you for tuning into our live chat here on Monday. We probably won't go past 3:30 today. The format for today is yours truly, just talking a little bit about COVID-19 Evolving Preparedness Plan. I have 6 topics today. One is a little bit about our current situation. 2 is testing. Third topic has to do with the latest news as of 5 minutes ago with vaccines. A little bit about visitation, number 4. Our dashboard, number 5 on touchdown. And then number 6, just want to talk a little bit about something called COVID WISE, W-I-S-E. First, I just want to thank the residents and team members and a couple families who took the initiative over the last couple days to write emails, send texts, and or call the administration office. On Friday of last week, I had asked for some information from anyone that's listening on the live chats to talk about these Monday, Wednesday, Friday live chats and how effective they are, what type of information is relevant. I received 57 correspondences over the last 3 days, and 55 of those 57 had to deal with keep with the format. We like Monday, Wednesday, Friday. We like the frequency. We like on Wednesday the fact that you open it up a little broader to community operations. Therefore, it's about an hour worth of a live chat. And one suggestion did come in about the dashboard. Instead of explaining the dashboard every time, Monday, Wednesday, Friday, if you really need to dive down into a yellow and a red, explain that a little further. But otherwise, if the dashboard is green, kind of move on. And so thank you to the 57 people who responded. Appreciated your feedback. And we will tweak these live chats here moving forward into the next couple of weeks to make it a better mode of communication for everyone listening. Second thing on my list is our current situation. First, I'm going to talk a little bit about some of the 7-day positivity rates that exist as of an hour ago. In the Commonwealth of Virginia, we are now at a 10.8. That's an increase from 9.6 last week. Central Virginia is at 12.8, which is an increase from 11.2 last week. Henrico is just about the same, 8.3. Richmond is also right at about the same, as a 5.5. And Chesterfield is an increase to 10.1 from 9.7. So the news here, the 7-day positivity rate in the state is rising dramatically. In Henrico County, we're still resting at about an 8.3, although that's up from 6.5 2 weeks ago. So what we're hearing on the news is actually reality here in the state and the region. At Cedarfield, our health center, our dashboard is green for the most part. We do have 2 residents who went to the hospital over the weekend, and those 2 folks will be tested and are quarantined here for the next 2 weeks. We did have another situation where we are monitoring somebody with signs and symptoms, but for the most part, health center is green. Assisted living, same thing, really. Our dashboard is completely green for residents and team members. We had one resident go out to the hospital over the weekend, and therefore that person will be under quarantine for the next several days. But other than that, team members and residents' dashboard is green. And in Sunshine Plaza, our memory support area, our dashboard is green. We, for both residents and team members, we're just waiting for one additional team member to cycle off. that person has not been working at Cedarfield for 3 weeks. And so that risk, or that COVID positive, is extremely low. And so I really consider Memory Support a green neighborhood. In the independent living apartments and cottages, we have cycled down from 8. Last week we were reporting 4 positive cases and 4 pending tests with a combination of residents and team members. Those numbers have decreased to 2 positives and or 2 tests that are still pending, 2 different tests that are pending. So again, those 2 positives that we have at Cedarfield are a very low exposure as we went through our contact tracing efforts. So that is our dashboard. For those of you that are just interested in the numbers, hopefully that was short and concise for you. With regard to testing equipment, I made this comment last week during a live chat that Cedarfield is now confronting the COVID-19 situation with 3 vital pieces of equipment. One is actually a contract where we send a specimen out to Jeanette Works to get tested with the most reliable equipment available to us, which is known as a PCR test here on Cox Road. So we have that testing equipment available to us still. We have a 15-minute rapid antigen point of care test, which was manufactured by Becton here at Cedarfield. This is otherwise known as the BD test that you might hear of in the media. And we also are getting the Bionex Now cards, which is commonly referred to as the Abbott testing cards. And so we have those 3. We are developing a policy which should be finalized tomorrow with an algorithm given the Virginia Department of Health's guidance as to when to use or in what combination to use these different pieces of equipment. So all good news, and stay tuned for that on Wednesday. I'll relay more information about that finalized policy. Another area I just wanted to chat briefly about is the vaccine. Obviously, in the Commonwealth of Virginia, we continue to see the rise of coronavirus. Implementing a very successful vaccination program is really critical to a term we haven't heard that much of since really the springtime, of flattening the curve and really stopping the spread of this virus, based on a December 4th conference call that I was on with the Virginia Department of Health, and listening to the guidance that comes out of that conference call with representatives from the CDC. They have an advisory committee. It's actually the Advisory Committee on Immunization Practices, which helps, that's the source of folks that come up with a different policy related to the rollout, related to Operation Warp Speed. Virginia is now preparing, in the event that you have not heard this number, Virginia is preparing to receive an estimated number of about 480,000 doses of the vaccine. That's a combination of vaccines from Pfizer and Moderna by the end of December. So we will receive that initial distribution. When you hear the acronym HCP, healthcare professional, that means that those folks that work in our acute care settings will have the first crack at the vaccination, and then long-term care, you'll hear the acronym LTCF, which is long-term care facilities. Residents will receive those vaccines as a phase 2 within that 480,000. We would suspect at this point, listening to the Virginia Department of Health, that as the state receives these vaccinations here early part of next week, that we will hear more from the Virginia State Health Commissioner, Dr. Oliver, that will talk a little bit more about the process for the rollout. And what is still unclear to me and most of us that are in the long-term care area is when we do finally, we meaning the Commonwealth, when we not only receive the first shipment, but more importantly, when we begin to roll out the vaccinations, is that 480,000 a combination of the hospitals, nursing homes, assisted living facilities, and or independent living communities? So we really don't know that answer yet. The good news is that the Commonwealth is anticipated to receive 480,000 vaccinations, and that the long-term care settings are at least second on the list. And that's really important to me and to many of us that work in and around nursing homes and assisted living communities. If you look at the demographics around the number of deaths that are happening in the United States, almost 80, I think my calculation was this morning, 80% of the deaths that are happening in the United States are folks that are 65 and older. And so the fact that we are in phase 2 is just great news, so that we can offer it to the people who live in any one of our settings here in Henrico County. There is an additional conference call on December 9th, which is Wednesday at 10 o'clock. Yours truly will be on that conference call with the Virginia Department of Health. And the purpose of that call is to talk through with the providers about what is the process to implement the vaccinations and to further define who is in this first and second phase. So hopefully by Wednesday afternoon, when we have our live chat, I'll be able to relay a little bit more information about the rollout here. If anybody has any questions about the vaccine rollout implementation, please feel free to call the administration suite and we will answer any and all of your questions just as soon as we can. Moving on to our next topic of visitation, I just want to thank all the residents and the families that are listening out there, either live or the video tonight. Thank you for your patience and your cooperation. We are doing a great job of supporting one another through this guidance here that the Virginia Department of Health recommended, and we have implemented now for going on 3 weeks, which happens to be no visitation at Cedarfield until December 14th. Hopefully these numbers start to shrink over the next week throughout the county, and we can make maybe a different decision point on visitation, especially moving into Christmas. But for now, I just want to thank everybody, the team members that are out there. I've heard many stories where the team members as well have reduced their visitation to people outside of their immediate home, to very, very small numbers. So again, thank you team members, residents, families. We are doing a great job, as evidenced within this dashboard right now. And so let's keep up the good fight, and continue to really stay respectfully separate from our loved ones and our friends as much as possible, so that we can mitigate any further risk, and we're all doing our part to keep ourselves safe and to keep each other safe. If you have not gone on to Touchtown, I would encourage you, www.mycedarfield.com. When you get onto Touchtown, there is a yellow icon that says coronavirus updates. When you click on that icon, you are presented with a drop-down list on the left-hand side. If you scroll up to the top, it says Dashboard at a Glance. If you click on that category, you'll be presented with a red light, yellow light, green light dashboard. I would encourage everybody to use this dashboard. Many people have commented on the usefulness of it, and a quick glance as to decision making that they normally do within the morning to decide what they can or cannot do around the community, particularly moving between one level of care or another. And so we try our best to update this spreadsheet every day, and it's another form of communication to keep people updated about our plan in a very visual way. And then the last thing for me, short and sweet here, 20 minutes, has to do with COVID-WISE. COVID-WISE, W-I-S-E. If you have not heard about COVID-WISE, COVID-WISE is the Virginia Department of Health COVID-19 exposure notification app to facilitate contact tracing in response to this global pandemic. Contact tracing is a very concerted effort. It's a technique used by the public health authorities to contact and give guidance to anyone who may have been exposed, or people who were positive get included on this database so that we can alert other people. This technique really is an essential part. It's not all of the part of the Department of Health's plan to notify the general public, but it's a plan to help transition folks with guidance as to know whether or not you are in and around somebody who has been on a contact trace list and or is positive. I bring it up because over the weekend I was shopping at the Short Pump Mall, and I have the COVID-WISE app loaded onto my phone, and have had it on my phone here for a couple of months. And twice, when I was in and around the mall, that COVID-19 WISE app was able to guide me as to perhaps where to go within the mall, because two different situations popped up on my phone alerting me that there's a potential hazard. So there's very traditional ways of using contact tracing, which we have binders located throughout the community and most frequently placed common space areas in the event that we do have to go through our own contact tracing here at Cedarfield. Because we have a positive, we can go through these manual ways of finding out who is in and around this space and who we might need to contact. So this particular technique, this app, if you will, is another way to protect yourself and protect those around it. It's only as good as actually the data that we use in it. So if anybody has any questions about COVID-WISE, you can certainly go on to the Virginia Department of Health's website. There's really simple directions on the website of how to download that app on your smartphone. If anybody has any questions, again, feel free to call the administration office, and we'll be glad to walk you through it. I think that's all for me today. Let me check my phone, see if we have any questions that came in via text. I don't see any questions coming in. More check on the email. Let me see if any questions related to this live chat have come in via email. And I do not see any questions come in email. So again, thank you for everything that you are doing. We are doing a great job. Keep up the good work. We are in the middle of a holiday season, and so social isolation is paramount, that we look at that dashboard as well, making sure that there is no resident or team member left behind. If you have a concern about a resident, if you have a concern about a team member, and you wish to confidentially let us know about that concern, we would be more than happy to address it. Our social services department is alive and well. Brian and Kathy are here to support folks in independent living. Our neighborhood leaders are equipped to address situations in memory support, assisted living, and the health center. And certainly our pastoral services department is here to serve as well. So we are now into our second week here into the Advent season. And as we draw closer to the main holidays, the management team is just really equipped and ready and willing to handle any issues of social isolation that you may bring up to us. So again, thank you for everything that you're doing. Keep up the good work over these next 48 hours, and we'll talk to you on Wednesday at 3 o'clock. Thank you. Have a great day.